Dr. Jacqueline Dupont.
Well, I want to thank you so much for having me here today. I'm looking out at the crowd and everyone is so educated, especially Patty, who knows everything about aging. She was the director of our education department for the Alzheimer's Association, and now she's doing so much more. And Pete, who's written a book I'm still reading, which I love it so much, but I'm so busy I can only read chapters at a time, on leadership. I love his book. Have you read his book? It is fabulous. You have to get it. I got extra copies on Amazon for my team, but it really is great, especially if you're working in an organization that needs leadership building or wants to know more about leadership. But thank you for having me here today. I really am not going to speak about my company too much. I mean, we love what we do, and you can go on our websites and see what we do, but we really honestly wanted to talk about aging. And what is aging, and then I looked and thought, there's so many experts in the crowd, I don't need to talk about this as much, but I'm going to briefly talk about aging in America. I know you all know that 13.5% of the population is over 65, and it's growing rapidly. The baby boomers aged. It was like a celebration in 2011. That was the first year they turned 65. So they're a large group, as you know, but we're not nearly as burdened as China. Germany's at 22%, is over 65. Sweden is 18%. Let me think. Gosh, Italy is 19%. Greece is 19%. So we're kind of behind everyone. China is the largest, and they're growing really rapidly, and they don't have the services. So we need to pray for them. They really need help, and they don't have enough daughters, as you know, because they don't have enough kids, and they don't have as many women because of their issue with abortion. So really, it's just a difficult time in China. So growing old is not easy in America, though, and it's been complicated. It's gotten so much better, though, and I have to say, in Orange County, we're really spoiled. We have a fabulous Alzheimer's Association that has so much education and training. They train their caregivers. They have caregiver symposiums. We have an education conference. I mean, Orange County is kind of a dichotomy. Our helpline is fabulous. I mean, we really have a different situation here. LA County is larger and doesn't have the same services, and they, you know, it's really a difficult time in LA. They're trying really hard, but you know, it's a big county. San Diego County's had ups and downs, you know, and it's widespread, and North County's growing at a rapid pace. So, but in Orange County, we have excellent aging services. The Office on Aging is well staffed. Medicare.gov is fabulous. So on first point here is our Medi-Cal services and our Medicaid services are really easy to get at. Medicare.gov is probably the best website you could ever go on. It's easy. Part D is easy, which is medications. Part A, most people already have, which is hospitalization. And then Part B is your doctor visits and your home health. So really, A, B, and D are pretty easy to navigate. But older adults typically aren't computer users. So today is to talk about being an advocate for the Catholic way. And what does that mean? Well, the Catholic way is really just a compassion term. And it could be the Protestant way, it could be the Baptist way, whatever way you want to talk about it. But it's all about being an advocate if you're caring for someone, or being compassionate. And being an advocate is really deeper when you're caring for someone older. It's a deeper level of advocacy. It's not shallow, here's information, call the helpline and you'll be fine. If you're caring for an aunt or a parent, you're sandwiched, or you're caring for even a neighbor, because we really do need to care for our neighbors. And often our neighbors really do need help, and they're not seeking it because they might not have children. There are quite a few older adults without children in this baby boomer population. They, for some reason or another, did not, have children. So they're, also needing advocacy. But being an advocate means getting online, helping them, getting them the Medicare they deserve, getting them the services they deserve, but also thinking outside the box and really thinking at a deeper level. And that's the compassion part, is what are they doing when they go to the doctor? What are they doing when they're at home? Are they getting services? Is there neglect? And when we see neglect, and Carla sees a lot of neglect just because she has to go out to the home, it's not purposeful a lot of times. It's really education. And I think Patty would agree with me too. They really don't want to lose their independence, especially at home. So they really want to stay at home as long as they can. So that sometimes means not getting a caregiver, not going to the doctor. There's just that negligence that you just have to, as a Catholic and as a Christian, get in there and help them. So with all these choices, it's important to note with Medicare especially that there's HMOs and Medicare. And it's really important if you're going to be an advocate for your parent that you know HMO senior care is totally different from Medicare Part A and B. Because when you have your Medicare, you're signing it over to a managed care position. So Secure Horizons, for example, is managed care. Kaiser's managed care. Blue Shield 65 plus, there's all kinds of managed care. But it's managing your Medicare. You really don't have control of it anymore. Your Medicare A, B, and D is not your choice. So if you want to go to UCLA with Alzheimer's, you want to go to their famous place, or you want to go to UCI, you really can't. They can't take managed care. They're going to manage it within their own experts. And sometimes it's good, and sometimes it's not. It's very difficult if you have a disease such as cognitive impairment of any sort. You know, there's many types of dementia. It's not just Alzheimer's, but say you had Lewy body dementia. Does Kaiser have a Lewy body expert? Can you be diagnosed properly? I'm not sure. So, and psychiatric needs, mental health is a little more limited. A lot more limited, I should say, to be honest, all you, because we're all Catholic, I have to tell the truth. So yeah, HMOs are hard. It's just difficult. It's difficult to get home health. It's difficult to get doctors of your choice. You can't go outside your primary. They kind of really hug you in on the primary care physician. So in America, we have 80% is covered by Medicare, and then you have that 20% gap. So what is the HMO? The HMO covers that 20% for free, because they're managing your Medicare rate. But if you really want your best care in America would be to have 80% and then your supplement. You would get a supplement. And what's a supplement? When you go onto Medicare.gov, it has all of them, you know, AARP, Humana, there's great supplements. Humana's kind of rated the 5-star right now, but they're rated off and on. But there's lots of supplements. And then there's Part D is your medications. And that was funded under Bush Jr., I think, and it's really easy to access. You look at your medications. Most seniors take 2 to 3 meds. It lists them. You click on and you figure out which one you want. But again, if you're 85 and you don't have any children, you know, we have to all be advocates and help. That's when it comes, you know, really into helping. But there's so many choices. So even in Orange County, we can stay at home and age. If we can go, you know, we can have doctors come in the home. Well, how do doctors come in the home? Doesn't that sound like 1955? No. As of 5 years ago, Medicare will cover a doctor to visit in the home. But again, you have to have Medicare and a supplement. You can't have the HMO. The HMO will send you to the ER or their clinic, or you have to go to their doctor at their doctor's place. So again, certain services can come in the home. Chest x-rays can come in the home. The pharmacy can be delivered at home. A lot of medical pharmacies now cater to seniors. Home care, what Carla does. Carla is a huge advocate. And when you're looking for a home care, I'm not going to plug mine, but I'll tell you, there's home care that just sends like any caregiver you can find. And then there's home care that really provides more case management. And that's what she does. So when we send a caregiver, we really train them. We have to follow up on, you know, what's going on in the home, you know, anything from dipping their urine to really checking on the person. Because again, the advocacy in some families, you might have fighting going on, you might have power struggles, you may have disorganization, hoarding, it goes on and on and on. So we really have to be advocates. We can't just send a caregiver into the home because there could be neglect, which, funny enough, you guys, we're in Orange County. It's a very wealthy county, as you know, but there's the super rich, which really are totally uneducated on aging, and the super poor, which are totally uneducated. And then there's the middle. And the middle really kind of knows what's going on and seeks services and is educated, but the two extremes are really hard to deal with, and we really need to help our poor. Our priests, of course, all of them, and our nuns, they're number one. Really, I'm so glad you guys are here. You're out serving, but someday we have to care for you. And we really have to take care of our priests. And in the PSA, when they talk about giving, we just have to always mention their needs are so great because they're all aging, And I get in trouble all the time from Father Urel, Monsignor Urel, excuse me, he always corrects me, because he says in that video that Hank put me on, I say, you're all aging rapidly. And he's like, I don't have a cane yet. And, some of us are young. You're always making fun of us. And I really don't mean to make fun of them at all. They just need a lot of services, long-term care. And priests, we need to be their advocates because really, I love the Servites. But they are in denial a little bit about their aging sometimes too. They're great priests though. But we need to care for them. They're super important. So that goes with our Catholic way too. But with home care, it's really about advocacy. Like I said, assisted living, you may find a beautiful assisted living. There's, small and large. Then we have our wonderful Catholic assisted living right here, which is, I've just heard fabulous things about. Anywhere you go, small, large, whatever, big community, buy-in, whatever, you might do a big CCRC or you might find just an assisted living. You still have to be your parent's advocate or your aunt or your cousin. When you visit, you still need to look and check those medications. You still need to call the doctor. You still need to be obsessive. People who have obsessive compulsive disorder that are Catholic do really well in this field. They really do, because they're detailed and they're, oh my gosh, my mom's sheets are dirty. You're right, they are, and they shouldn't be. I mean, they're advocates. And it's, not that I don't think I have OCD and I'm still an advocate, but on the whole, you have to be obsessive about their care. You have to check that their catheter's been changed. Assisted living is non-medical, but trying to be medical. So in the old days, we had all skilled nursings, as you know, and skilled nursings are highly regulated, more regulated than the nuclear industry. Super regulated in California, over-regulated, most would say. Then we opened up assisted livings that had no regulations at first and now have few regulations. And as an owner, do I want more regulations? Well, when we added the med tech training, yes, we needed it. Caregivers need to be trained in assisted living because they're now dealing with really frail older people. Because people with money are waiting longer to move in, then they're moving in totally frail, and we are a little hospital. So if we're going to, take people's money and be a little hospital, we have to act like one. So we need more nursing, and families need to pick based on care. The care has to be good. And they need to look at not only the smell, because they can have aromatherapy, but they have to look at what do the people look like in the home? What does their hair look like? What do their hands look like? Are they walking around? Are they getting music therapy? Are they getting enjoyment? It's just so much more than just an assisted living anymore. Do they have a doctor that visits? There's all these things that we really need to think of. And if anyone needs help with that, they can always call the Alzheimer's Association, but we can help too. It's really important to have a good, really thorough checklist. Hospice. Hospice is really, Carla and I went to the medical ethics conference at Notre Dame last year, and it was really interesting because we were the least educated there. People had multiple PhDs and MDs, and we were like, wow. I mean, they were from all over the world, Harvard, everywhere. But they really debated hospice quite a bit and the end of life. And what is euthanasia and what isn't. And, many papers have been written from priests to Catholic organizations on terminal sedation. And I don't mean to talk about something so morbid, but terminal sedation is, giving someone so much morphine or sedation from any medication that they are pretty much in a coma. And as Catholics, we feel I think just from reading the literature, I did a quick literature review yesterday and the day before and really pulled a lot of papers from some great theologians that terminal sedation probably is not what God wants for us. We are a pro-life religion, and we believe that life should be respected all the way through till we die. And that morphine is fine for pain, but not fine to just go into a coma for maybe ease of transition or, lack of care, whatever the issue is. So that's heavily debated, just to talk about our Catholic views here, and really important when I talk to priests, especially my Servite friends who I really love, and they go into a home. I just talked to one last week, and he said, Jackie, can you talk to these facilities and tell them, when I come in, could you be awake? Could you not over-medicate the patient so I can do his last rites? Or, he said I'm sorry, what's the new term? Anointing of the sick. And could you please just tell them to give them maybe an ADHD medicine to hyper them up so I can, I said, Father, I don't think it works that way. I don't think the Ritalin's going to counteract the morphine. But I was laughing so hard when he said that. He's like trying to think of a way to get them to wake. And I got his point, because we do see a lot of over-medication, and that isn't right. And as Catholics, we do need to speak up, and we do need to say, we want our parent comfortable. We don't want them to suffer, but we don't want them over-medicated. And with Alzheimer's, you see more over-medication, Do you want to question?
Because we have elementary human sedation, which is really
Yes.
overprescribed, and it's the other side, because they're too active.
Right.
And it's interesting.
Right, and in many fields, but in this field, it's putting them in a coma. And one priest wrote a great article, I should have brought it today, and it was on, if my mom has pneumonia, why are you not giving antibiotics to her? Why are you not treating the disease? Even though she's dying, I don't care. We believe in treatment. We are Catholic. And he wrote this great paper on it. And it really made me think, because I do think, and Patty knows this because Patty's worked in hospice, and so many of you are working in hospice, you have too, that, there's a urinary tract infection and someone's dying. Do you give morphine just to knock them out, to treat the pain, or do you give the antibiotic, to take it away? We really have to, and I know this sounds so detailed, but really it's a way of life for us. We see it every day. So we have to be an advocate for our seniors. And I really want to mention that there's so many aging older adults in Orange County that are so bright and older, from 65 to 85. That group really has some wonderful normal aging cohorts that are really vibrant, riding their bike, still working. And I don't want you to think we're only talking about today like everyone's dying, and very small percentage need care, which is great. Because in America we have vitamins, we're more of an advocate for ourselves. We're checking our B level, our D level. We're really aging well. So I don't want you to think today is all about but because we're talking about caring for older adults, and that's what Mark asked me to talk about, I really want to make the point that not all seniors are, really that sick. They really aren't. They're doing really well, and we really need to use them as our role models because we all want to age that way. So I have a funny little chart here I did on the second page on Catholic, because Carla's a teacher and she's taught me to do this. I've never done it before. But some of the points while you're caring for someone is to always be compassionate, to have a lot of advocacy, meaning you speak up, you can't be shy, trustworthy, trust the caregivers, yet verify. Reagan said that, and we keep that really true to self. Mark mentioned I'm a big proponent of elder abuse, and I've sat on many task force, but I have cameras in my facilities. I'm the only one in the United States to have cameras in the bedroom still. A few people will put in cameras, one-on-one, but to have a comprehensive program. And we really believe that you need to trust the nurse or the caregiver, but you do need to verify. You do need to see, were they changed? Where's their incontinency changed every 2 hours? Were they walked? Because it gets confusing also to caregivers when they're working. They do kind of end up like blurred if they're not taking notes. So the cameras do help. They help with a lot of delusions. Because a lot of times older adults with dementia will say, last night I was raped. You were? Oh my gosh, well you have to always look into that, don't you? But when we go back and look, maybe the male that changed them and they don't prefer a male, that bothered them. Or maybe they did it too fast. Something triggered this aggressive delusion. And sometimes aggressive delusions are from the past, so we don't know. But either way, we have to always listen to older adults. You don't just wipe it away and say, okay, she said she was raped last night, and we don't do anything about it. You have to always look. And the cameras verify that nothing happened. but they make you feel so much better. And even dentures. You can't believe the loss in assisted living. So losses make up for about 20% of dentures, hearing aids, clothing. I mean, you know, big facilities, it's very hard to manage everyone's clothing if they're not labeled properly. So it does become a problem, but the loss of eyeglasses, and it all adds up to millions of dollars. And the cameras, I can literally just go on the iPad, figure out where they put it, and they usually dig it into the wall, put it in their napkin, throw it away. It's usually the older adult, you know, confused about their issue. But still, we have to find it. So it does take quite a bit of time on the camera, but it does save thousands of dollars. And I have to say, that is a big problem. So you have to be an advocate, label everything. If you're ever going to place your older adult in the facility, just make sure, you know, if they don't have cameras, I would totally go through the whole, eyeglasses have a label on them, hearing aids have a label, and ask them if you could install a camera. Some facilities will let you one-on-one. In home care, we do recommend cameras. We make every caregiver sign that there could be a camera in the home, because we do have older adults that we've recommended. You have way too many valuables, and if you don't want to put them away, you really need to have a camera system. So it's important. And then, of course, you know, we have cameras in other areas as well. You know, you have cameras in the hospital even. So, and you know that. You're probably watched all the time. If you're in ICU, you're watched all the time. And I always say, what's the difference? ICU, they're critical care, but we have someone who can't report. You know, they can't protect themselves. So it's two different ways. But that's my whole abuse talk, and I do believe we have to be an advocate in that area, because there's lots of abuse. There's financial abuse, which is huge, and it should be getting better, and it seems like it's getting worse. And a lot of times it's families. So we really do have to watch that. But the pro-life section, you know, I already talked about that. It's super, super important. Everyone has their own point on it, but I know we're Catholic and we can talk openly about respecting life. And obsessiveness is just taking lots of details. Prayer, not only prayer for them, but getting them to pray. If they are Catholic, you have a higher chance of getting them to really connect with the Lord with dementia, because their prayers are stored in their long-term memory. And Patty knows that she's given so many wonderful services. The Alzheimer's Association even does, you know, prayer services for the demented, which is so wonderful. And that's just fabulous, and they really enjoy it. She does different religions, of course. But I see with the Catholics that I take care of, not just the priests, but everyone, they really want to pray the Rosary, and they want to pray the Our Father, and they want to pray the Hail Mary. They really do, and it really is such a peaceful existence when they do it. They're so happy. There's just such a beauty about it. I hired a chaplain from St. Thomas Aquinas, a really lovely girl, and that's all her job, is just to pray with the Catholics. But she prays with the Protestants too, and she brings her Bible, so you got to get into a little more. Maybe you should go over to Saddleback and just sneak in and just watch them, and then we do a better job with the Protestants, because they really want more Bible reading and other things. But one of my ladies, I'll just tell you real quickly, she volunteered at St. Michael's Abbey her whole life. She answered the phone. And, well, it was most of her life. She was there a long time as a receptionist, volunteering. She hadn't spoken in 9 years. She had Alzheimer's, just was at the end of life on hospice. And her daughter had jumped ship. She was going to Saddleback. And she didn't see Catholics Come Home, the video. So she went over there. And she's a very lovely girl. And she said, you know, I'm not Catholic anymore, but I think my mom still is. I go, well, of course she is. We always are, and you are too. She didn't like me saying that. But I said, why don't we bring over a Catholic priest from the Abbey to thank her? You know, because she should be thanked. And then also to give the other, you know, but I snuck that in later. So Father Damien came over. He prayed with her. All of a sudden, Florence starts saying, Our Father, who art, she starts talking. And she said all her prayers. And the daughter's crying hysterically. I'm looking at her like, and I'm remembering, when was the last time Florence spoke? She's only been with me for 2 years, but she said 9 years. But that's really us. That's our faith, and that stays with us forever. And I know the sisters could tell you that. But it's important, and so many Catholics forget about it with their parents. I don't know if they're overwhelmed by the caregiving. Probably. They're probably just overwhelmed. But we need to encourage our friends that are caring for their parents to do that. So anyway, in closing, I did give my stages of Alzheimer's. There's so many different stage charts. Because the biggest problem I see, and Carla will attest to, is denial. There's still a lot of denial, but with all the education we have a lot of denial of the disease. And so many people will say, well, my mom just has huge memory loss. She repeats herself 5 times a day, but you know what? She's just normal. She's normal. But she's not. And with normal aging, there isn't memory impairment. So it is important to note these things are occurring, and we need to get help. We need to call the Alzheimer's Association. We need to engage online. We need to join a support group from them. We just really need to, because it's such a complicated disease, and they can't be an advocate for themselves. So getting the more information you get, the better.
Dr. Jacqueline Dupont.
Oh, thank you.